colon cancer warning signs. Blood in the stool, always a red flag, okay? Even if you think it's hemorrhoids, I want you to see your doctor because it may not be hemorrhoids. Hopefully it's just hemorrhoids, but it could be something else. We worry about colon cancer. What we also call something called a change in bowel habits. If you're normally regular and all of a sudden things change up with your bowels, or normally you can go just fine, but all of a sudden you're constipated. Any sort of change that's persistent in your bowel habits is something that we get concerned about. Also abdominal pain, right? Like, okay, abdominal pain that doesn't go away, that's not normal, whatever. Yeah, we worry about that. Or things like bloating or nausea or vomiting or diarrhea or constipation. Once again, any of these that are sort of alterations of what is normal for you, okay? But the other thing is changing caliber of the stools. As we say, size, or rather shape, does matter when it comes to stools. Let's say your stool changes shape or colors or things like that. Your stool gets skinny or thin. Yeah, we want to know about those things too. But it's not just sort of gastro symptoms that can be a problem. We also worry about if you lose weight unintentionally. You lose weight, but you weren't trying to. That always worries me, and you should be seeing your doctor. An anemia or low blood counts that's unexplained. Feeling like you have to have a bowel movement, but when you actually have one, you don't feel relief. You don't feel any better. That feeling doesn't go away, that urge. That's a concern as well. Weakness, fatigue, that's unexplained. There are other potential symptoms as well. Those are the big ones, okay? Now, you might be saying, well, I don't have any of those. I'm good. I don't need to be screened. No, the purpose of screening is to find things before they are a problem, to screen you, to look at things when you are asymptomatic. Certainly if you have any of those symptoms, you need to be ASAP in your doctor's office. But even if you don't have those symptoms, especially if you don't have them, we need you to get screened when it's time. So when is it time? The age for screening for colon cancer is now 45 years old for those at average risk. What does that mean? That means if you're not at high risk for colon cancer, you should start getting screened at 45. If you are at high risk for colon cancer, you likely got to start earlier. And I know you're saying, well, who's at high risk? That would be people who have a family history of colon cancer, a family history of polyps, or you've had polyps, you've had colon cancer, you have inflammatory bowel disease like Crohn's or ulcerative colitis, you have a genetic condition that predisposes you, etc. That's a whole different ballgame. So that's not what I'm talking about here. I'm talking about if you're just like average, none of those things, you got to start at the age of 45. Yes, we have the colonoscopy, but we also have stool tests as well that many of my patients are opting for if they qualify, okay? There are different modalities or ways to be screened outside of just the colonoscopy. So if that was the thing keeping you from getting your colonoscopy before or colon cancer screening before, don't let it be, because we got more stuff, okay? We've got more options. The idea is 45 is when you should start. Most important thing is to get that screening so that we can catch colon cancer early if it is to be caught, and we can hopefully treat you and all that good stuff, okay, guys? I hope this is helpful. Colon cancer screening is so important, along with breast cancer screening, prostate screening, you name it. We have many different, lung cancer screening, etc. So make sure you get screened. Guys, write in the comments if you have received colon cancer screening, if you have had colon cancer, if you're going through some things. Super, super important, certainly for all of those who are suffering with colon cancer or have loved ones that are. We send you our deepest prayers and well wishes. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. For those of you on Facebook, please like and follow my page. YouTube, please subscribe to my channel, click the little bell for updates. Guys, please check out drjencaudle.com for my free health newsletter. Also, for those of you on Facebook who send stars, I will respond to you personally. Guys, I'm Dr. Jen. I'll see you soon.